According to Walter Longo, the combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone, published in the Journal of Metabolism 2015. So I'd like to share with you a few case reports, what actually happens with real people when they go through fasting. And this patient was a 41-year-old female who'd been diagnosed as follicular lymphoma. This is a type of cancer involving the lymph system. This is a particularly interesting cancer for us because there is no effective medical treatment, and so watchful waiting is considered reasonable, not unethical behavior. And as a consequence, this particular patient had been tracked for 2 years by her family physician, and it got bad enough and she became symptomatic enough that he recommended that she go to the med school for chemotherapy. She asked her doctor, was there anything she could do to slow down or reverse the process? And he said no. She said, what about diet? And he said, no, diet is not related to lymphoma. And she said, what about fasting? And he said, well, that's criminal quackery. So she went to the oncologist. The oncologist also told her that there was nothing that she could do. Diet was not an effective treatment for lymphoma, and there was no reason to think that fasting would be of help to her. So now this patient had been very carefully diagnosed. She had her CT-guided biopsies. There wasn't any question about her diagnosis. So given the tremendous medical encouragement, she came to the True North Health Center, where she underwent 21 days of water-only fasting, during which time her tumors disappeared. So we could no longer feel any tumors. She did 10 days of refeeding, and we sent her back to the medical school with some very specific instructions, because we knew we needed to get a follow-up documentation. During the 21 days of fasting, she'd lost 22 pounds, and she resolved her masses. Now, when she went back for her follow-up, the doctor examined her, and he looked at her chart, and then he examined her again. He looked at her chart, and he looked at the picture, and he looked at her, and he said, what happened? And she said, well, I went to the criminal quacks, and I did the fasting, and the tumors disappeared. And he said, my, I'll have to give them a call. And then she said, I'd like to have a CT scan. Then he got a little nervous, and he said, no, you don't need any CT scans. And she said, but she'd like to objectify the change. And he said, you don't need to objectify the change. I've been in practice 25 years, and I'm telling you, you don't need any CT scans. And then she said, well, what if there's cancer lurking just beneath it? And he said, okay, fine. So he ordered a CT scan, told her that because her white count was still low, perhaps she should have some gentle chemotherapy. And she refused and said, maybe we should watch and see what happens with the dietary change. At 6 months, well, first of all, you notice she went from 152 pounds. At 2 months, she was at 139 pounds. How did that happen? She followed the whole plant food SOS-free diet, continued to lose weight as expected, down to her optimum weight. At 6 months, she was at 138 pounds, and her white count was entirely normal. When she went back to the oncologist, he agreed that she was better now, told her to come back at 12 months, which she did. And so at that point, we decided maybe it was time we should try to write this case report up. So we wrote this report up. I called my colleague John McDougall up. I asked him what he thought about us submitting this case. He said, yeah, that was a good idea, since we had objective evidence. And I said, I thought maybe we'd send it to the British Medical Journal. He suggested that probably wasn't going to work because they weren't going to publish. It was too big of an impact journal. Sent it to one of the smaller journals who'd have a better chance. He said he had submitted an article there, rejected it. He wasn't too happy with them. So given that sage advice, I, of course, immediately sent it to the British Medical Journal. And after some back and forth, they did actually publish that paper. This was her CT scans before and after, and that was the paper that came out. Water-only fasting and a exclusively whole plant food diet in the treatment of follicular lymphoma. But they said, look, a small percentage of people go into spontaneous remission, so could you follow this patient for a number of years and then submit a follow-up? Because maybe it was just luck. So we said fine, and we followed this patient for 3 years, during which time you'll notice that at 3 years she was 136 pounds. So what had she been doing? following a whole plant food SOS-free diet. I had told her that she needed to follow a whole plant food SOS-free diet or it could be fatal because I would track her down and kill her. And apparently she believed me because she did stick to the diet, at which time whole body CT suggested there was no evidence of pathology. So we submitted a second paper to the British Medical Journal, which was immediately rejected by a reviewer that said, oh, she's probably just lucky. But we did appeal, and they did ultimately publish this follow-up as they had invited us to submit. And now I'm happy to say we just got a 4-year follow-up on when she continues to be both compliant and healthy. So this next case report it was a dentist that came to us. She had been at a dental convention, got hit in the head by a pole, developed a dural tear, and had, as you can imagine, a headache. But in her case, the headache didn't go away for 16 years. So she'd had constant daily head pain, 8 out of 10 or higher, every minute of every day for 16 years, despite trying Neurontin and drugs and seeing various neurologists. So she was pretty desperate. She'd become disabled, and she came to us to do fasting. And so we agreed to fast her for 40 days to see what would happen. And the first 19 days, she had no relief at all. She had constant daily head pain. On the 19th day, she said she woke up and for the first time in 16 years had woke up without a head pain. It lasted for almost 5 minutes, and then the pain came back. And we continued this fast of 40 days as planned. And by the end of 40 days, she was largely better. She wasn't having any acute pain. She had a few prodromal symptoms. And we went to break her fast, but she insisted on fasting one more day. And I said, why do you want to fast one more day? And she said, because the men fast for 40 days. You know, Moses, David, Elijah, Jesus. And she said, women always have to do just a little more. And so we let her go to 41 days. And then we refed her for 6 months. We rebuilt her. And during this time, she didn't have any severe headache, but she had some prodromal symptoms. She was still not quite right. And so after 6 months, we reinitiated another period of fasting for another 40 days. And at the end of that second 40-day fast, she was out of pain. And we published a paper with a 6-year follow-up. She'd had 6 years without pain. And this was a challenging case, clinical practice, long-term relief from chronic post-traumatic headache after water-only fasting and an exclusively plant foods diet. I'm happy to say we now have an 8-year follow-up on this patient. She continues to comply and be healthy. So this case report was a case of non-pharmacologic, that is no drug, management in a case of uncomplicated subacute appendicitis. So this gentleman came in, was told he needed surgery to remove his appendix, which I think we heard yesterday may actually have some utility. But rather than go through the surgery, we chose to help him with medically supervised water-only fasting. And this paper reflects not only his recovery, but 2-year follow-up, where he's maintained his health and his cooperation. This next case report involves a mass that was detected in a patient that was a 66-year-old female who was obese, high blood pressure, hypothyroidism, had back pain, degenerative disc disease, and she'd had this recent onset of intra-abdominal and pelvic pain, swelling, and nausea, despite the fact she'd been on a vegan diet for 14 months. Is a vegan diet healthy? Yeah, it just depends, because a vegan diet just means there's no animal food. So to the degree that there's no meat, fish, fowl, eggs, and dairy products, that's good. But is Coca-Cola vegan? Are Oreo cookies vegan? Okay, so if a person was on an Oreo cookies, French fry, potato chip, Coca-Cola diet, is that a healthy diet? Okay, so she was on a vegan diet, but it wasn't a health-promoting SOS-free diet. But she'd been on a vegan diet for 14 months, so her doctor referred it to us. And they had done a CT scan which showed that she had a mass. It was 4 and change by 4 and change centimeter mass around the left common iliac artery. She'd been diagnosed as having hydronephrosis, proximal ureterectasis, kidney cyst, and malignant neoplasm or fibrosis. They decided they needed to do a biopsy to tell if it was cancer or fibrotic lesion. Either way, they were going to be recommending surgery. So what she did instead was she came to True North Health Center, underwent a period of medically supervised water-only fasting against the vehement objection of her physicians, I might mention. And that was her CT that had confirmed her mass. After a 13-day water-only fast and 11 days of a whole plant foods diet, during which time she experienced nausea, diarrhea, abdominal pain, fatigue, episodic chest tightness. Sounds wonderful, doesn't it? She had what I call an entertaining fast. And by the time we were done, though, her weight had dropped significantly, her blood pressure had normalized, and on follow-up scan, her kidney and ureters were normal. She had resolved her hydronephrosis, and they had to cancel the biopsy because there wasn't enough residual lesion to actually biopsy. Next case is a woman that came to us, referred actually by Dr. McDougall. She was blind. She had Fuchs endothelial corneal dystrophy and was told that she had to have replacement surgery. Dr. McDougall will sometimes send us patients, but he says we're the punishment. He'll like apologize to the patient. He'll say, you have this problem. You need to go up there. Good luck. Thanks. So her vision acuity had dropped to 20/200, and she had been tracked. This is for about 15 years that she'd been doing this, and was told that she needed a corneal transplant. So she described it as if someone had put wax paper over her eyes. She was unable to read, cook for herself, walk without falling, or identify people in social circumstances. So it had gotten bad enough now that she wanted to do something really dangerous and radical, and that was change her diet. And she did. And within 15 days of her arrival at the True North Health Center, she started to notice vision improvement. By 4 months, we were able to objectify that change. She had gone from 20/200 to 20/40, uncorrected, and her ocular pressures had normalized, and she has her vision back now. She's also lost 100 pounds and continues to do very well. In fact, that paper has been accepted for publication, I believe, in March in one of the journals.